Hello lady and gentlemen. Welcome to Remedy 24. Today we are going to show you, is vitamin C effective in treating colds? Vitamin C supplementation will not prevent you from getting a cold, but it will help you recover faster and lessen the severity of your symptoms. While supplementation may be necessary to achieve the high vitamin C intake required to alleviate cold symptoms, be careful not to overdo it. That's because too much vitamin C might have negative consequences. Whole foods are often a superior idea for meeting your fundamental nutrient requirements. Oranges, kale, and red bell peppers are all strong in vitamin C and are healthful foods to eat. The common cold is the most common infectious sickness in humans, and most people get it many times a year. Vitamin C has been touted as a therapy for a variety of ailments. Is vitamin C effective against the common cold? Linus Pauling, a Nobel laureate, popularized the idea that vitamin C can help heal colds about 1970. He wrote a book about how to avoid colds by taking megadoses of vitamin C, up to 18,000 milligrams per day. In comparison, the recommended dietary allowances for women is 75 milligrams and for men, it is 90 milligrams. There had been no solid studies at the time that confirmed this to be true. Several randomized controlled experiments were conducted over the next few decades to see if the vitamin had any effect on the common cold. The outcomes have been underwhelming. Supplementing with 200 milligrams or more of vitamin C did not lessen the chance of acquiring a cold, according to a review of 29 studies with 11,306 participants. However, regular vitamin C supplements had several benefits, including 1. Reduce cold severity. They lessened the severity of a cold by reducing its symptoms. 2. Reduce cold duration. On average, supplementation reduced recovery time by 8% in adults and 14% in children. In youngsters, a supplemental dose of 1 to 2 grams was able to cut the duration of a cold by 18% on average. Adults have been shown to benefit from 6 to 8 grams per day in other trials. In persons who are under a lot of physical stress, vitamin C appears to have an even larger effect. Vitamin C reduced the duration of the common cold in marathon runners and skiers by almost half. How does vitamin C help to make colds less severe? Vitamin C is an antioxidant that is required for the skin's collagen production. Collagen is the most common protein in animals, and it helps to maintain skin and other tissues strong while remaining flexible. Scurvy is a condition caused by a lack of vitamin C, which is no longer a problem because most people obtain enough vitamin C through food. On the other hand, vitamin C is highly concentrated in immune cells and rapidly depleted during an infection. On the other hand, vitamin C deficiency lowers the immune system and raises the risk of infection. As a result, eating adequate vitamin C while sick is a smart idea. Other nutrients and foods that could be beneficial. The common cold has no treatment. Some meals and nutrients, on the other hand, can aid the body's recovery. People have employed a variety of meals to alleviate their symptoms in the past. Few of them have been scientifically confirmed to work, but a few have. 1. Flavonoids. Antioxidants found in fruits and vegetables are known as flavonoids. According to studies, flavonoid supplements may reduce the incidence of infections in the lungs, throat, and nose by 33% on average. 2. Garlic. Garlic has antibacterial properties that may aid in the treatment of respiratory infections.